Welcome back to Plastic Surgery Untold, one of the greatest podcasts in the world, voted by me. This is a topic that's near and dear to my heart. Paul from Get Hair MD. So talk about this, because those of us that are thinning just a little bit, there may be a few solutions that are now.
You know, when you've been down there, yeah, we got to talk. Okay? So, first of all, our company, Get Hair MD, we've got about 41 locations in our network, and we've assembled devices and other products. Some we manufacture, some we partner with companies to give a total solution for hair loss, because hair loss typically, one thing really does not work. So this whole package that our physicians can use, so they've got a whole toolbox to affect hair loss.
And that's one of the things that's unique about your company is that, both for practices and for patients, is you've basically tried to simplify this for everybody so that it's a one-stop shop stuff. You can get everything you need, because I think you're 100% right. A lot of people said, oh, I've tried the hair stuff. And when you ask them what they've tried the hair stuff, it's one off here, one off there. Yeah. And then it's not super surprising that they maybe weren't successful.
Right. Yeah. And I mean, that's exactly what we hear all the time. And there's so much confusion and a lot of stuff that's, I won't say snake. I guess I said snake oil. It's really hard to know what works and what doesn't. If we want to build the most trusted brand in hair loss, which we know we will build in conjunction with our physician, it's their credibility that'll build the brand to be a trusted.
And one of the things that from what I know about your company, which is absolutely amazing, is that you guys have also created a system, and because of your large network, you're able actually to make these treatments cost effective for patients, and so that they can come in and actually have something they can afford a treatment, because this is going to be an ongoing process for most of us.
That's right. And so and every patient has their own goals, right? And they have their own ability to afford so much. And so there's kind of good, better, best. So the physician can talk to them and they can at least get started, because even if it's just the good, it's going to work, maybe slower, et cetera, but there are choices they can make.
And then it's super interesting just because I think a lot of people don't realize, even if you do hair transplant, do something else, you should be doing this if you know that that's something in your future. Right. And even if you get hair transplant, you need to take care of what you have. So there's so many different time points where people can get involved in this, no matter what they've done or plan to do in the future.
Totally agree. And interesting enough, now physicians do grafting and we can help them do that, but the bulk of our focus is non-invasive. And if you catch it early, then you can avoid the grafting. And we're actually about 52% women. And one of our fastest growing segments are women, that are suffering from hair loss. And it's, guys, we don't want to lose our hair, but half the guys already did. Women, it is devastating for them to lose their hair.
I think you hit on two big points. One, you can't start soon enough. And most of us, if you wait till there's a problem and you've only got one or two little hair strands left, probably not going to be super effective at that point. Yeah. And so the sooner you get started, the better. I think the second part of this is that, with the GLP medications and so many people coming into the aesthetic industry, I think there's so many, and there's also some thought that GLP maybe affects hair a little bit. I think that's going to be interesting where you guys fall with that.
No, it does, because I was just reading a report and it is significantly affecting people for hair loss. And so people will need to take care of that.
That's so awesome. Just for people listening, if they want to get more information, whether they're a surgeon or a patient listening to this, where can they find more about Get Hair MD?
Well, it's www.gethairmd.com. I'm CEO of the company, Paul Herschman, paul.h@gethairmd.com.
Awesome. Paul, I appreciate you taking time out of your busy schedule. This is super exciting. Hair's obviously a topic that's near and dear to my heart that we're going to talk some more, but Plastic Surgery Untold. I'll see you guys soon. Bye.